Good morning, y'all. I'm Ethan. I've been asked today to do a quick video on enhanced contact for the rooms. This is in the OR mainly an issue with our C. diff patients, but the contact precautions can be applied to most other cases. A while back, they sent out a quick guideline on transporting patients in contact escalation to the OR. This was sent out in the emails. If you have a chance, please review it. We're going to briefly touch on it today, just to give everybody a quick overview. So, if you have a C. diff case or any contact case for that matter, in a perfect world, you're going to want to remove all excess equipment from the OR. In this case, we only have our bed, our tower, our Neptune, and our table. At this point, you'd be bringing in your case cart and starting to set up. We can still retrieve supplies from our cabinet, except for when the case has officially begun. So anything that can be wiped down is okay to be brought into the room, but if it can't be wiped down, please don't bring it in. Outside our room, we are gonna have a couple of things. On our door, we're gonna have our contact precaution sign, whether or not it is C. diff or it is any other type of contact such as MRSA. That way anybody entering the room knows what type of PPE to be wearing, what type of pathogen that patient might have. We're gonna have a contact cart, which is gonna have our new white gowns, which are less permeable than our yellow ones, as well as our contact signs, which you're gonna choose based on the case you're in. We're gonna have N95s, we're gonna have glasses, and then all of our gloves. So once we move our patient from the patient's bed to the OR table, we are gonna strip all the sheets, all the linens off that bed, and we're gonna clean that bed before pushing it out into the hall. Again, with C. diff, we're gonna be using our bleach wipes. For other pathogens, we're gonna be using our sanding cloths. And then once that bed has been stripped and cleaned in the OR, we're gonna put it out into the hall so that the PCTs can go ahead and redress that bed for us. Hey y'all, we're outside of our contact room here. Before we go in, we need to make sure our consent is taken care of. And so for all our contact patients, we need to have a 2-nurse consent, which means a verbal consent from our patient. And so on this consent, you're gonna see 2 nurses have signed and consented for this patient based on a verbal consent that the patient has provided for our procedure today. The chart and the consent do not enter the contact room. They stay outside the whole time. We just finished confirming our consent and making sure we have everything we needed in our procedure room, as well as before we start the surgery. So now we're gonna go and say hi to our patient. To do that, we're gonna need to bring some wipes. We're gonna need to bring a new blanket or sheet, depending on what you prefer, if they're cold or not. Since our room is contact, we're gonna put on all our PPE before going in. Once we've talked to our patient and confirmed their name, date of birth, allergy, and procedure that we're doing, we're gonna go ahead and take away their old blanket. And we're gonna put that in the linen bin, and we're gonna give them a new blanket. A new clean one, straight out the warmer, so it has a lower risk of carrying any sort of pathogen to the OR. And then we're gonna take our wipes, if it's C. diff, it's bleach wipes. If it's normal contact, we're gonna take our normal sanding wipes, and we're gonna wipe down anywhere that we're gonna be touching. So it's gonna be bed rails, it's gonna be handles. We're gonna just wanna make sure that gets nice and clean. Where we'd be touching and helping guide the bed. So that way we're not contaminating other surfaces in the hospital. So if we're using the IV pools, we're gonna wipe that all down. And then once we've done all of that, we can go ahead and get ready to take our patient to the OR. Because we are going to the OR, we're gonna have 2 transporters. We're gonna have a CRNA who will generally be at the head of the bed, transporting the patient, and an OR nurse who at this point will take off their PPE, go and do hand hygiene. If it's C. diff, again, you're gonna wash your hands. And then they're gonna be pushing all the door handles on their way to the OR while the CRNA drives the bed. Now, if the bed does require 2 people to drive, seeing as you just wipe down the bed, you can now touch these handles safely because you wiped them down. Just brought our patient into the room, we're going to go ahead and put on our PPE. So we have our new white gowns. We have our gloves. And so just to note, on transporting your patient from ICU or the contact rooms to the OR, you will have one clean person and one dirty person. Our CRNA is always going to be our dirty person. So they will be wearing their gowns the entire time they are transporting. You are going to go ahead and make sure that consent is good before rolling back, but the chart never enters the patient's room. So once you've confirmed everything and you're rolling back, you are going to perform hand hygiene, which is in C. diff cases, you're going to be washing your hands in the sink. In other cases, it's going to be your hand sanitizer. And once you roll back to the hallway and entering your room, your CRNA is going to enter the room. You're going to go ahead and put on your PPE as would anybody else who's entering the room. You're going to enter your room, and everybody else who's going to be in this room also needs to be wearing PPE. If you take off PPE to leave the room for any reason, you need to perform hand hygiene. Again, if it's C. diff, you need to wash your hands. If it's other pathogens, hand sanitizer is okay. And then you can move your patient over from their stretcher or bed to the OR table. Once the patient is in the room, we are not allowed to open up the cabinets. Those cabinets do contain supplies that we don't want to contaminate and pass to other patients. And so those cabinets need to stay closed during procedures. If you need supplies and you're not leaving the room because you are in your PPE, you can always call for a runner in the core to bring you your supplies to your room for your case.